Hey drivers, YouTube's Department of Transportation physical expert Dr. Nuesse back bringing you more information on commercial drivers and the medicals that go along with being a commercial driver. And in this one we're talking about people that are looking to get a CDL, that are transitioning into commercial driving, what you should know before going in to take your medical examination. All right, so the FMCSA, the Department of Transportation, has a whole bunch of rules, whole bunch of guidelines as far as the physical fitness that a driver needs to have a CDL, to be able to get a CDL and to be able to keep a CDL. So if you're looking to get a CDL, please watch this video in its entirety because I'm going to go over a lot of the stumbling blocks that I see with people coming into my office, drivers coming into my office, trying to get their medical examination done and not being exactly in compliance. So there's some things that can trip you up, and I want to go over those, and I want to give you some advice on doing things beforehand that can help maximize your chance to pass your medicals, get your CDL, and get on with your career. All right, and the first one is a biggie, and it's about drug and alcohol screening. So are you going to be drug tested? When are you going to be drug tested? Are you going to be tested for alcohol? The answer is, if you're getting a CDL, the FMCSA considers CDL drivers to be safety sensitive in a safety sensitive job, similarly to pilots or train engineers. So safety sensitive jobs must have drug and alcohol screenings. So you're going to have a drug screening when you get your CDL, and you're also going to then be subject to random drug screenings, and you're also going to have an alcohol screening before you get your CDL as well. So it is important to note that if you are a CDL driver, this does not apply to all commercial drivers, but if you are having a CDL, you're going to be drug screened, and I've done a complete video on what that drug screen looks for. I'll link that video up here in the corner, but the drug screen is going to happen, and it's going to be an alcohol screen as well, and then you're going to have random drug screens then throughout your career. So that is a very important point. Be aware that when you go in to get your medicals done, you're going to be screened for drugs and you're going to be screened for alcohol as well. All right, and number two, this is going to affect a lot of drivers as well. It's the issue of obesity and commercial drivers. So the FMCSA sets up these standards, and they suggest that anyone with a BMI over 35 or a neck circumference over 17 inches, they're going to suggest that the medical examiner, us, send you for a sleep study. They don't want people obviously falling asleep while driving, and not getting a good restful night's sleep because of sleep apnea may be a reason why you become drowsy during the day and then fall asleep and unfortunately cause a crash. So they're trying to prevent that. So if you fall into one of these two categories, BMI over 35 or neck circumference over 17 inches, and when you go in to get your medical evaluation done, they may be measuring your neck size. So if you fall into either one of these categories, just be aware that the medical examiner may request that you have a sleep study done. Now, piggybacking off of this point, if you've already had a sleep study done, bring in that information with you to the physical. And if you are doing any treatment, if you use a CPAP or a BiPAP machine, bring in that data with you. That's called compliance data. We are going to want to see that so that we know that you are complying with the treatment that was prescribed to you, so that we're aware that it is safe for you to drive. So that is a big one. All right, and next let's talk a little bit about vision. And this one actually may be changing. There are some proposed changes to the vision standards. I will make an update video if that and when that comes about. So please really consider subscribing to this channel and hitting that bell icon next to the subscribe button, because when a new standard comes out, I will release a video so that you are aware what the new standards are. The FMCSA is not going to tell the drivers, it's going to tell the medical professionals, but I want you to be informed. So please subscribe here and hit that bell so that you know when these changes are made. I will make an update video. All right, as far as the vision goes, currently what the vision exam consists of is a field of view vision of at least 80 degrees. You have to have at least 20/40 vision in both eyes, And that can be with glasses or without, and you have to be able to determine red, amber, and green, basically the colors of a traffic light. You have to be able to meet those standards in order to be medically certified to drive commercially to be able to get a CDL. Okay, and I know I keep saying this over and over again. I keep saying this is another biggie, but this is one that's going to affect a lot of people as well, and it's the FMCSA's stance on smoking and current smokers. So if you are looking to get your CDL, if you are a current smoker, I would suggest quitting smoking. The FMCSA is very clear about this. Smokers over the age of 35 years old are required to have specialized lung function testing. This is a specialized test that most providers' offices do not do. We have to send you to a hospital or a testing center to get these tests done. It is costly, it is time consuming, and then you have to fit into very particular standards as far as that test goes as well. So if you are not a current smoker, the FMCSA does not require this test. So please quit smoking before you come in to take your medicals as far as getting your CDL or your DOT physical, and it takes away this automatic parameter. Now, the medical provider still might want that test to be done, but it's not automatic as it is with current smokers over the age of 35. Again, another biggie. All right, and let's talk just a little bit about blood pressure. I've done a complete video on blood pressure. Again, I will link that video up here on the top if you want to know all of the parameters. But just because you have high blood pressure does not mean we are going to disqualify you. Now, if you're taking blood pressure medication, if you're being treated for high blood pressure, it does limit your certification to a maximum of 1 year. The maximum for the DOT physical to be medically certified is 2 years, but if you have high blood pressure, it limits you to a maximum of 1 year. So if you have high blood pressure, please just take your blood pressure medication before you go in, so we're not reading the blood pressure high, because if it is high, we may have to delay your certification. So take your blood pressure medication beforehand. Don't drink any stimulating drinks like coffee or Red Bull or anything like that unless it's medically necessary for some reason before going in to take your exam as well. And then bring a list of the medications that you're taking as well, because we're going to probably want to take a look at that. So don't think that just because you have high blood pressure that we're going to automatically disqualify you, but as much information you can bring us, the better, and please do everything you can to manage your blood pressure before going in to take your exam. Blood pressure is another biggie. Okay, and I do from time to time have a driver come in to take their medical exam and they've had an amputation. They've had a foot amputated. They've lost a thumb, something like that. Now, in these particular cases, you are going to be sent, and I always send for somebody that's had an amputation that is missing an appendage that might be important to use to drive. I always send them for a skill performance evaluation. This is done by an orthopedic specialist. You will go into their office and you will go through a test to determine is it safe for you to operate a motor vehicle based on your particular amputation. So this is very, very important. If you fall into this category, just be aware that most likely when you come in to take your medicals, we're going to have to send you to another provider just to make certain that it is safe for you to operate a motor vehicle. All right, and finally, let's talk about some prescription drugs that you may be taking, things that were actually prescribed to you for a medical reason that may actually cause you to be disqualified and not be able to get your CDL, and then I'll also talk about a workaround for that as well. So obviously we've talked about illegal drugs. If you're taking illegal drugs and we screen you and you fail a drug test, you're obviously not going to be able to drive. You're not going to be able to keep your CDL. Alcohol the same way. But some drugs that are actually prescribed to you for a legitimate reason are disqualifying as well as far as the FMCSA standards. So these are drugs that typically treat something like anxiety, or depression. These are what the FMCSA calls habit-forming drugs. I've done a more complete video on all of the particulars. I will link that video up here if you just want more details. But some prescription drugs are disqualifying. And the workaround to this is if a doctor that prescribed you the drug can write you a letter saying that it is safe for you to operate a motor vehicle while taking this drug, and you bring this in with you to your Department of Transportation physical, then we, the medical examiner, can use this and say, well, the doctor thinks that it's safe for you to drive, then potentially we can certify you, we can get around that disqualifying factor from the FMCSA. But this is a very important one. So if you're taking anything for anxiety, anything for depression, or any of the other drugs that I listed in that other video, please just go to your doctor, ask them for this letter. It's called a compliance letter. Bring that in with you, and we should be able to then certify you as long as we don't see any other reasons why we should not. All right, so to anyone out there looking to get their CDL, to get into trucking or commercial driving, I hope this was very, very helpful and informative. Please make sure that you comply with the medical standards and do all of the steps before going in to get your medical exam done, just to make things easier and less costly, obviously. Good luck out there, and until next time, drivers, stay safe.